Hi, everyone. My name is Dr. Leanna Wise. I'm a physician here at the University of Southern California. I work at Keck Medical Center and also at the county hospital across the street, Los Angeles General Medical Center. And thank you so much to Lupus LA for having me here for this Facebook Live session. I hope this is helpful. I received some wonderful questions last week on lupus and pregnancy, and I'm very excited to talk about this. This is a subject that's near and dear to my heart. I treat a lot of patients with lupus, and this is a very, very important facet of good lupus care. And unfortunately, something we don't talk about enough with our lupus patient. So let's get started. Before we get started, I'm just going to say here that what we talk about is not going to be, this is a bird's eye view of lupus and pregnancy. So everything that I discuss, you need to ask your doctor also. I am a physician, but I'm not your physician. And as has probably been discussed in many other lupus videos, lupus patients are very diverse and heterogeneous, and lupus is a disease that differs a lot from one patient to the other. So I just want to be really careful that what I say is not something that can be prescribed or something that can be said across the spectrum for all lupus patients. And so I'm going to talk about certain conditions and certain recommendations, but again, lupus patients are very different from one patient to another, from one person to another. Medication regimens are different from one person to another. Patients' other conditions are different from one person to another. So just take that with a grain of salt as we talk about these things, and make sure if you have any concerns or questions that you're discussing these issues with your own rheumatologist and OB-GYN as well. So let's go ahead and get started. We'll move through some of these questions, and I'm actually going to lump some of these questions together. There's some common themes here, and I think you're going to hear recurring issues and recurring themes, and some of my answers are probably going to sound redundant because there's some very important issues we'll talk about throughout our 20-25 minutes here together. So I'm going to talk about one of the first questions right off the bat is, how does lupus complicate pregnancy? And I think we're all pretty aware that lupus is a disease that unfortunately strikes women who are mostly what we call in their childbearing years. So mostly women who are in their teens, 20s, 30s, and 40s. And this is when women are trying to start their families. And they're at their peak, what we say, childbearing years. This is when they want to get pregnant. And they're trying to maybe not get pregnant. They're trying to use contraception safely, or they're trying to have a baby. And unfortunately, we need to get the lupus fully under control if possible before they get pregnant. And the medications we use to manage lupus can affect the pregnancy. And so this is how it complicates pregnancy, because we have to get the lupus, one, under control. We don't want patients to get pregnant when the lupus is active. And then two, the medications we're using can be problematic during the pregnancy, both for mom and the baby. So it's a very short, simple answer. It's the lupus itself that can complicate the pregnancy, and then the medications. And we'll talk more about this in depth. Talking about the medications in particular, I think this is a good segue. Someone has asked here, is it common to be able to go off of lupus medications when trying to get pregnant and then go back on them after delivery? So we're going to talk about medications here for a while for lupus and pregnancy. There's a thought that medications for lupus are dangerous for the babies. And I want to point out here that in general, we have to be very cognizant and very thoughtful about what medications we're taking when we want to get pregnant. This is a very good thing to be thinking about. But one medication in particular, hydroxychloroquine, often known as Plaquenil, this is a very good medication to be on when you're pregnant with lupus. Again, there's very, very few exceptions to this. When we're on Plaquenil, you need to get your eyes screened. Make sure you're getting your eyes screened by an ophthalmologist. Ask your doctor about that if you're not already doing that. But this medication is very good to be on when you're pregnant or trying to get pregnant with lupus. So it's not that all medications across the board should be stopped. And I have some patients where maybe they haven't been seen for a while, and they said, oh my goodness, I'm trying to get pregnant, or I am pregnant, and they stop all their medications because they're under the misconception that all medications for lupus are bad for the baby. And this is problematic because hydroxychloroquine or Plaquenil is very, very good for pregnancies in lupus patients. And two, when we stop all of our meds, there's a chance that the lupus can flare. And that's actually very dangerous for both mom and baby. We think of mom being healthy, we think of then baby being healthy. So the best way to have a successful pregnancy in a lupus patient is having mom be healthy first. So we really want to focus on mom being as healthy as possible. This goes back to the very beginning. How do we have a successful pregnancy in lupus is we get mom into remission. That is our number one goal. So we cannot talk about a healthy pregnancy until mom's health gets under control. And this brings us back to that very first question. How does lupus complicate pregnancy? We don't want to see active lupus when patients want to get pregnant. So this brings us back to this idea of let's get the lupus fully into remission before mom wants to become pregnant. And this is going to kind of segue into this other topic. Someone says here, do you have to go into remission before trying to get pregnant? Absolutely, yes. So if a patient comes to me and says, let's say she's 20, 22, or 30, 32, and she says, I have just diagnosed with lupus, but one of my short-term goals is to have a family. I said, that's great. We can do that. But that is stage 2. Stage 1 is get your lupus under control. Actually, maybe that's even stage 3. Let's talk about it more in stages. Stage 1 is get your lupus under control. Absolutely, your health comes first. You cannot have a healthy pregnancy in the future if your health right now is not fully under control. Whatever medications that I or your rheumatologist feels are warranted to get your health, your lupus under control, that is top priority. So that's stage 1. Stage 2, after your lupus is in remission, we get you onto medications that are safe for pregnancy. That's stage 2. And then stage 3 is hopefully to get pregnant and have a successful pregnancy. Okay, so stage 1, get the lupus under control. Get mom as healthy as possible, into remission or as close into remission as possible. And then stage 2, transition onto pregnancy safe medications. And there are some for lupus. Not all lupus medications are dangerous for a baby or dangerous for mom during pregnancy. And then stage 3 is to hopefully get pregnant safely, carry the baby during pregnancy, not flare during pregnancy, and then deliver the baby, hopefully breastfeed, and then continue to have the lupus stay quiet, and then maybe even explore further pregnancies down the road. So it's a process. You can't be diagnosed with lupus and then say a week or two later, say, I also want to become pregnant. It's a slow but steady process, and it requires a lot of planning with the rheumatologist and planning with an OB-GYN as well. Let's see here. So let's go back a little bit to medications. So I'm going to circle back to this question that was asked. Is it common to go off of lupus medications while trying to get pregnant and then go back on them after delivery? So that's a little bit of a subtle question there. Yes, we may go off of some medications, but let's go back to that staging there. So that's going back to stage 2 a little bit. We may take you off of some medications that are dangerous for a baby, but I'm not even going to talk about that with you or with my patients until I know that you're fully in remission. We may transition you from a drug that's known to not be that safe for baby, and we may transition you to a drug that is safe for baby. And then once we see that you're doing well with that, your kidneys are quiet, your skin is quiet, you're feeling well, your labs look good, we kind of give the green light to, okay, get pregnant. But we would never, ever, ever want someone to stop their medications cold turkey because they are pregnant or because they're trying to get pregnant. And again, I want to go back to that idea that Plaquenil or hydroxychloroquine is very, very good for pregnancies and lupus. It's actually been shown to help increase the chances of healthy pregnancies in lupus and baby being healthy when baby's born. There is a condition called antiphospholipid syndrome. We talked about this a little bit in lupus and hormones when I did the last Facebook Live. This relates to question number 2 we were asked last week. If you have lupus, are you at greater risk for DVT, which is deep vein thrombosis? This is blood clots. Are you at greater risk for blood clots when you're pregnant if you have lupus? Yes, you are. This is particular if you have something called antiphospholipid syndrome. So this is something that patients should be asking their doctors about, antiphospholipid syndrome. If you're going into pregnancy or even considering pregnancy, there's 2 major complications you should be asking your doctor about, and asking your doctor if he or she has screened you for these. Antiphospholipid syndrome, which is the risk of blood clots, and then something called SSA and SSB positivity, and these are antibodies. So as many of you know, lupus is an autoimmune disease and is associated with certain chemicals or molecules in the body called antibodies. And some of these antibodies They're just markers. They don't really do anything. They just might mean that you're at higher risk of certain complications, but some of these can actually cause problems. And in particular, the SSA or SSB antibodies can cause problems for the baby, in particular, heart problems. So we ask our patients, or we'll encourage the patients to ask their doctors if we're giving out informational material. Ask your doctor about whether or not you've been screened for antiphospholipid syndrome, which is the blood clot disorder, or SSA or SSB positive labs. And these two comorbidities or problems with lupus can complicate the pregnancies, and we will screen patients in a very particular way if they have these problems, and we will treat them in order to lower the risk for the baby throughout the pregnancy. So those are other ways that lupus can complicate pregnancy. These things sound very scary. And I think a good question to ask, and someone did ask this last week, is, are lupus pregnancies always high risk? I would say generally compared to the population of healthy women without lupus, yes, they are higher risk. But that being said, we see many healthy pregnancies, and maybe I would even say normal pregnancies for women with lupus who have healthy babies. It's very possible to have a healthy pregnancy, but we have to do it carefully. I would much rather have a woman be considered high risk and go to her rheumatologist regularly, her OB-GYN regularly, and then everything to turn out fine, rather than go into a pregnancy and say, you know what, I don't need to see my doctors that regularly. I think everything's going to be fine. I'm not going to worry about it. I would rather overshoot and call it high risk and everything to turn out normal, and it be medium risk and not as concerning. So I'd want to almost presume the worst. I would want to presume that we have to keep an eye on her carefully, get frequent blood pressure measurements, maybe keep a close eye on her labs and her urine, and the standard things we look at in lupus. And at the end of the day, say, you know what, we did a lot of extra blood work and we were really careful. And at the end of the day, she was fine and the baby was healthy. I would rather be too careful and consider lupus pregnancies high risk, because some of them are, not all of them, but some of them are. And we're talking about a baby and mom here, and I don't want to mess up. So yes, we're going to call these pregnancies high risk, but I'm not doing that to scare a patient or to scare the partner or to scare the family. I'm doing that for the mom and baby safety. This is a pregnancy we're talking about. This isn't an ulcer on a toe, and not to belittle an ulcer on a toe. That's a problem too. But we're talking about mom and baby. This is a very serious issue here, and I want to make sure that we have the best possible outcome when we're talking about pregnancies. So yes, there are higher risks than the general population, and we call them high risk because we want to make sure that mom and baby have the best possible outcome. Along the same lines, there's also the question of, is it true that lupus patients are at a higher risk for preeclampsia or preterm delivery? The answer to that is yes. Lupus patients are at higher risk for preeclampsia, which is a kind of high blood pressure and kidney issues, and preterm delivery, so delivering the baby earlier than expected. Yeah, the lupus patients are at higher risk for both of these than the general population. But again, the answer to this is somewhat similar to the idea of high risk as the prior question. So I'm going to monitor these patients very carefully, and we will be seeing these patients frequently in the clinic, especially in the third trimester, as will an OB-GYN physician. There's some risk factors that are associated with higher rates of preeclampsia. So this is patients who are taking extra steroids. And these are also patients who have a history of kidney problems when they become pregnant. So if you were told that you have a history of lupus nephritis or lupus affecting the kidney, or you're taking a lot of steroids through the pregnancy, or you have a history of high blood pressure, these would make me want to monitor you a little more carefully. So it's not just that all lupus patients are all the same across the board. Everyone is different. Going back to the statements I made at the very beginning, everyone is different. And so there are risk factors as we look at patients who are 20 versus 30 versus 40 years old. We can kind of stratify patients based on their age, their risk factors, et cetera, maybe how they did in a prior pregnancy. And we can say, you know, you are a little higher risk for preeclampsia based on your medications, based on your history, et cetera. So it's not everyone's exactly the same. We can't predict, but we're going to maybe presume the worst just so we take care of patients the best. And at the end of the day, I'd far rather be too careful rather than too lax. Let's see here. So we also have a question of, are there lupus medications that you have to stop if you're trying to get pregnant? Absolutely, there are lupus medications that you have to stop. So this goes back into the idea of lupus being in remission before getting pregnant. So many medications that we use to get lupus fully in remission, mycophenolate, mycophenolic acid, cyclophosphamide, leflunomide, methotrexate, absolutely these must be stopped before getting pregnant. These are something called teratogenic, which mean they can damage the developing baby. It's not 100% that they'll damage the baby. Sometimes we see pregnancies that are fine, ironically, but they have a very high chance of damaging the baby. So we encourage women who are on these medications to use 2 forms of birth control or have an IUD placed, which is a form of birth control. It's the little T device that goes in the uterus. This is a very reliable form of birth control. So we do not recommend that women are on these medications before they try to get pregnant. If you are trying to get pregnant or you're hoping for that in the next 6 to 12 months, we recommend that you talk with your rheumatologist about transitioning into a pregnancy-safe medication. And again, there's a lot of them. Well, maybe not a lot, but there's several of them that we can do. So again, get to that stage 1, get the lupus in remission, talk about getting to stage 2, which is transitioning to pregnancy and safe medications. We'll watch how you do on those pregnancy safe medications. And then once you have your doctor's blessing, then you can try to get pregnant. Now people will say, okay, that's great. Let's say I'm in stage 3, I'm trying to get pregnant, or I am pregnant. What happens if I flare? We can treat the flare. It depends what that flare looks like. For some patients, it might be some aches and pains. For some patients, it could be very scary. It could be the kidneys become active and inflamed again. So it's going to depend on what the flare looks like. We can treat with steroids. You are all probably very familiar with prednisone. We can give prednisone by mouth. We can give prednisone as a muscle injection. We can give prednisone even as a joint injection. If someone has a knee that's bothering them or a finger, we could give prednisone even as a joint injection. It's very much depends on what the flare looks like. It's safe during pregnancy. We don't want to give repeated amounts of prednisone over and over, but it is very safe during pregnancy. It's probably going to be one of the safest. Now, if someone has very active lupus during pregnancy, it's going to be a risk benefits discussion. And it does go back to that idea that we must preserve mom's health. So the baby's health, it's not that baby's health is not important, but baby's health is so dependent on mom's health that the best thing to do for baby's health is to keep mom healthy. So whatever we need to do to keep mom healthy, that's going to ultimately help baby. So if it is perhaps changing some medications around, perhaps using some medications that are not well studied in pregnancy, sometimes that happens. And I can't say right off the bat what I would do in every situation of a bad lupus flare. For sure, it's going to be some steroids. But sometimes we have to talk with the mom and the OB-GYN and say, look, we're in a gray area. We're in uncharted territory. We have to use some medications that we're not super comfortable with in pregnancy, but we have to talk about risks and benefits. And we may have to take a little risk to save your life or to preserve your baby's life even, because if your health goes downhill, your baby's will as well. So it's a difficult discussion. But as you guys know, with lupus, difficult discussions sometimes had to be had. So we hope and pray that patients don't have flares during pregnancy. And that's why it's so important to get the lupus into remission before you become pregnant. The more well-controlled your lupus is before pregnancy, the less chance you have of flaring during the pregnancy. I think that's also a good segue into, does pregnancy make lupus worse? And that's a great question. Generally speaking, pregnancy does not make lupus worse. But one thing that does seem to flare more frequently than expected is lupus in the kidneys, unfortunately. So lupus nephritis. And this is difficult because some of the ways that lupus nephritis shows up, as many of you are probably aware, are high blood pressure, protein in the urine, swelling of the feet. And these are all things that you can see in pregnancy, just normal pregnancy without lupus. So it can be really difficult to figure out, is this due to pregnancy? Is this due to something called preeclampsia in pregnancy? Is this due to some medications that we use, something called tacrolimus or calcineurin inhibitors, which we use in pregnancy for lupus sometimes? So it can be actually pretty complex to tease these things out. But we unfortunately do see lupus nephritis flare relatively frequently in pregnancy. But pregnancy in general does not just make lupus explode and flourish. And in general, if we're thinking of the types of flares that we see most frequently, it's lupus nephritis or lupus in the kidneys. But I'm going to go back to that what I've been saying over and over. Most important thing is to have the lupus as well controlled as possible before you go into pregnancy. There's some other unusual, not unusual, but maybe unique things about pregnancy that can kind of complicate things. Is when you're pregnant, you do have a lot of aches and pains, as probably some people on the call have been pregnant. Aches and pains are common during pregnancy, and it can be hard to differentiate, is that the lupus flaring or is that just the aches and pains of pregnancy? Patients who are pregnant can also become anemic or have low blood levels, and that can also complicate the picture. Is the anemia due to lupus or the pregnancy? And then also something called complement, which is found, low complements can be found in lupus. The complements can actually go up in pregnancy, which can kind of mask the way things change in lupus. And even the white blood cell count can change in pregnancy, which can kind of change the way we see it move around lupus. So it's the immune system in pregnancy can change just because of the pregnancy. And so that can kind of mask the activity of the lupus. So it's very subtle. It's a subtle dance that the immune system is doing both in lupus and in pregnancy. And so when you put the two together, it does require an astute OB-GYN, someone called maternal fetal medicine specialist, and then a good rheumatologist to help manage the patient. So those 9 months that the patient is pregnant, I think we're just being very careful. And again, that goes back to that idea of let's consider the patient high risk so that we're keeping a really close eye on the patient, making sure the patient understands the appointments are really important, get the labs, get the urine done frequently, and making sure that nothing is getting lost to follow-up, so that we're keeping close tabs on everyone. There was another question about, is it safe for lupus patients to do IVF, in vitro fertilization? This depends on the patient. So whenever there were some guidelines that were put out recently, relatively recently, on assisted reproductive technologies with rheumatic disease patients. In general, the thought is if the lupus is extremely quiet and in remission, you can carefully proceed with IVF. But if you have a history of antiphospholipid syndrome, you are at more risk for having blood clots during the IVF procedure. And a OB-GYN would actually help to manage that by giving you some anticoagulation during the procedure. So it's not a total no-go, but you have to do it very carefully. One, the lupus has to be fully in remission. And then two, you would actually get some anticoagulation during the procedure if you're not on it already. So very careful ground that you would tread there. But the big caveat is the lupus has to be fully under control before you even go down that route. When you get IVF, the ovaries are stimulated and you get more estrogen, and this leads to a higher chance of blood clots. So that's why you just have to be incredibly careful with that. Let's see some other questions here. We also have one other thing I'll comment on here about the complications of lupus and pregnancy. I think it's just worth noting that when we're pregnant, our blood volume goes up by 50%. So the amount of blood you have circulating is 50% more. So if you have any history of high blood pressure, which we can see in lupus frequently, sometimes that's from steroids and sometimes that's from kidney disease from lupus, or if you have a history of kidney disease, having that extra blood is a big burden on the body. And so that's another reason that pregnancy can be hard on a body who's already taken a toll from lupus. So that's another way the lupus can complicate pregnancy, and pregnancy can complicate lupus. And so it's another reason why we're just keeping a careful eye on blood pressure. You know, you might have a doctor, an OB-GYN or the rheumatologist say, please buy a blood pressure cuff and use your blood pressure cuff at home, and just keeping tabs on things. And then let's see here. I think there was one other question we had. Someone had asked, there was one more question that had come in. If you have lupus, can you have a successful C-section and recovery? And I would say for sure you can. I've seen this in my patients. I would say the key thing with any surgery and any autoimmune disease, whether it's lupus or rheumatoid arthritis, is the less prednisone you can be on, the better when you go into a surgery. Generally, the wound will heal the best when you're on a lower dose of prednisone, but if you need that C-section to get baby out safely, and if the OB-GYN says we need to get baby out, and the best way to do that is through a C-section, doesn't matter what medication you're on, and that's what the OB-GYN feels is best for baby's health and for you, get the baby out safely and go for it. Now, in a perfect world, you should be on the lowest amount of prednisone in order to help the C-section scar heal well, but we don't live in a perfect world. So I would say I would prefer a patient to be on less than 10 milligrams of prednisone going into a C-section. If they know it's a scheduled C-section, try to get them off, make sure they're on some other safer pregnancy compatible medications. But yes, I've seen many lupus patients have a C-section and recovery, and I again would like to have them on something like azathioprine, tacrolimus, of course their Plaquenil that we've already talked about, and they go on to recover quite well. But we're really focusing on making sure that when they get to the pregnancy, the disease is already in remission. We're not using lots of prednisone to control the disease, and we're on safe medications for their lupus. Let's see here. Let me see if I can address any last things. We're hitting about 25. Brianna, do we want to take any other further questions?
Yeah, I don't know if this is one that you can comment on, Dr. Wise, but Jess is asking, is a low white blood cell count of 2.5 too low to begin conceiving? My room wants to wait for one more round of blood work before any treatment for it and then begin trying.
So I can't comment on individual care. I can't comment on the individual care, but I'm not aware of any contraindications to getting pregnant with a low white blood cell count. But in pregnancy, the white blood cell count can fall a little bit. So they might just be concerned about it falling a little more, but I can't really comment on an individual case. There's no guideline that says you have to have a certain white blood cell count in order to get pregnant though.